All right, we will go ahead and get started. I wanted to welcome everyone to the Horizon Government Affairs post-election webinar, and we're going to talk about where we are, what we know today, and where we're headed in healthcare in the lame duck and next year, actually for the next 2 years. My name is Joel White. I'm the president of Horizon Government Affairs, which is a bipartisan healthcare consultancy that I helped found in 2007. We are a bipartisan team of experts who care very much about making healthcare work better. We've helped enact 50 laws and have interacted with the administration on dozens of regulatory wins and also with the states in securing hundreds of millions of dollars in federal and state funding. So we take our job seriously. Before I started Horizon, I was the staff director of the Ways and Means Health Subcommittee, where I worked on 9 different laws, including the creation of the Part D program, the Part B reimbursement model, health savings accounts, and a number of laws that reform payments for hospitals, doctors, long-term care facilities, imaging, etc. And at that time, I was also responsible for almost a weekly hearing agenda. So have a lot of familiarity with the congressional process of setting up oversight and hearings. And I think that's going to be a big part of the year next year. So happy to be here. Glad that you're here. And let's just dive right into it. So I think, the first thing that struck me about the election was that we had 4 primary issues. The economy and inflation was obviously the top one. Is a poll from Third Way that came out the day before the election of likely voters. Immigration and the border was number 2. Protecting abortion rights, number 3 there, and then reducing crime was the top 4th issue based on voter preferences. And if you think about those 4 issues and where Republicans and Democrats really played, it was in those 4 boxes, and each party played to their strength. You can see on the left side there, the party advantage based on what they focused on. Both had double-digit leads on the issues that they really focused on. I would say the Republicans were much more disciplined on message on those 3 issues that they really highlight. And those issues had broad cross-party constituencies. And I think the Democrats were less disciplined. There were issues related to abortion, but also January 6th, their record, the Inflation Reduction Act, things like that. And but they were much more narrowly tailored, especially the abortion issue, with much more focused on their base and getting out the vote, which in midterm elections is very important. Moving on from here, that discipline, I think, translated into the results that we saw in the Senate and the House and the state houses. And the Senate side obviously is coming down to Georgia again. I think we'll know Nevada and Arizona, looking like Nevada will go Republican and Arizona likely Democrat. And so, with a pickup in Pennsylvania, we're really looking at Georgia. And I think that there are a number of different reasons. I think the messaging discipline on the Republican side didn't play off. We'll get into those implications in a second. But either way, it's going to be a very narrowly divided Senate, very similar to what we see this year, whether Republicans are on top or Democrats are on top. So in terms of the House, what we see, for the Senate, sticking with them for a minute there, I think what I've heard from a lot of questions from Republican circles is, did Trump kind of lose us the Senate 2 times, 2 different cycles? And I think, we went back and we looked at like the people that he endorsed and the success rate in the primaries and general election. And you can see there he's about 77% on the ultimate outcome with his endorsements. Now, some of these endorsements were people that were probably going to win. And we circled the folks there that are, either undecided or who lost. Kelly Tshibaka is probably going to win that. Blake Masters, unknown. Levy lost. Walker, runoff. Laxalt will probably win. Bolduc lost. Oz lost. And Malloy lost. And so, I think there's a lot of tension right now in the Senate. discussions around, did Trump help? Did he hurt? Was McConnell right? What about Rick Scott? Those kinds of conversations are happening right now, but you can't dispute the ultimate success rate. 77% is pretty good, higher than where it was in 2018. And so in terms of the House, we're going to focus on the House in this webinar because it looks like the House will be controlled by the Republicans. It's not determined yet. These are the numbers as of about 9 o'clock last night. And I think, with 44 remaining races, we've got 9 solid Dem, 2 likely Dem, 8 lean Dem, 10 toss up, and then 5 likely GOP and 10 lean GOP. And a couple of surprises that were coming out overnight with, Democrats, I think, outperforming in certain districts. But the point shouldn't be lost that this is significant change. It will change dynamics in Washington and the power balance, and will result in divided government, not one party rule. And so this is significant, maybe not as high as expectations, but certainly a sea change in terms of how Washington is going to operate in the next 2 years. You can go to the next slide. In the states, not a lot of change, but there were a couple of things that we wanted to highlight here. Obviously, Massachusetts, Maryland, flipping on the governor side, with 4 races undecided as of last night. Massachusetts and Maryland will be fully controlled by one party, where that wasn't the case last year. Republicans will fully control at least 21 state legislatures and executive offices. And there was one new attorney general that Republicans picked up with 4 undecided races. And then South Dakota, not necessarily known as a leftward leaning state, did approve to expand their Medicaid program as part of a ballot initiative. And but not a lot of change at the state level. A little bit of direction in the Democrat direction. So in terms of the winners and losers and our takeaways, I mean, I think you can kind of look at the winners and losers there. What I've been surprised by is kind of, we had this expectation, Republicans, there was going to be a wave. There wasn't a wave, a red wave. But Republicans won in terms of ending one party rule. And so while we didn't meet expectations, we definitely, or most likely will win the House, and that will end that one party rule. The other dynamic, obviously, DeSantis landslide election in Florida. Trump, came out before the election and kind of criticized the governor. And like I said earlier, with the Senate discussion ongoing, I think there's been a lot of unhappiness about, how that might have played out, not the least of which was the candidate quality selection process, and some of those races turning out to be closer than a lot of people thought based on the vulnerability of the incumbent, particularly in New Hampshire. But I think the DeSantis thing, the other takeaway from that is that he has definitely changed the dynamics of the 24 election. And I think in a significant and disruptive way. And I wouldn't want to underplay that. I think that if there's a fight between Trump and DeSantis, DeSantis definitely positioned himself well on Tuesday in terms of what happened in Miami and Dade County and, across the state, really. And what we saw with Hispanics moving into the DeSantis camp by double digits in some areas. So that was a significant change. I think Democrats won in that they exceeded their expectations. They avoided a blowout, but they probably have lost the House, and they may lose the Senate based on the runoff. And that's, going to have repercussions for leadership. And what we saw in the numbers was that the country was much more evenly divided, and the races were closer, even though we had very well-defined issues and people were passionate on those issues. And the races were much more competitive as a result, but the playing field, I think, has narrowed. And Republicans picked up some swing seats. And I think they're going to have to try and figure out how to govern from the middle in order to hold those long term. And then finally, I think on healthcare, I think gridlock may win out if Republicans don't figure out a way to move to the middle. If Biden doesn't move to the middle like Obama did in 2011, we may not get a lot out of Congress. We may get a lot of vetoes. And I think that's bad for healthcare because there's a lot of problems that need to be solved by Congress, particularly in Medicare and in terms of the ACA and other programs. But healthcare has not been a focus of the GOP. It wasn't a focus in this cycle, and it hasn't been for the past 3 cycles, and that kind of bothers me. It bothers me in the sense that everyone knows what the Democrat plan is. The Democrat plan is price controls and expand government programs or government-run healthcare. And I'm not sure anyone outside of DC can name with specificity what the Republican healthcare agenda or plan is. And that's not good for thinking about like 2024. I mean, there may have been clever reasons for the GOP to have avoided healthcare this time around and in the last 3 election cycles, but it's going to be very hard to make it to build a mandate for change for a president in 2024 and 2025 if issues like healthcare haven't been vetted and signed off on by voters. I think one of the things that we saw in 2016 was this repeal and replace agenda. Repeal was pretty easy to get and I think appropriate. The replace wasn't well defined, and I think that hurt. And it hurt Trump when he came in to try and figure out where he needed to go. And, I think the next 2 years are a transition year to that presidential where Republicans are going to have to build the case around healthcare, and it better be what voters want. And it should be what resonates with voters so that in 2025, if there's a Republican president elected, they're able to hit the ground running. And just to kind of follow up on this last couple of winners, losers, oversight, we expect to be a huge issue. I think it's going to take up and eat up a lot of time on the Biden administration. So that's a downside in the losers category. And then obviously losing one party control between the president and the Congress is harder to get your agenda through. And we expect that one party control to end. And then the last point with the Republicans, very focused on small business. Lot of antagonism against big business, whether it's investment strategy or environmental concerns, or whether they supported the Inflation Reduction Act or other issues. And so I think that Republicans are going to be very focused on small business and small business health concerns in particular. And I think that begs for questions, right? We don't see a mandate from this election. We're open to suggestions, but the mandate doesn't seem to be well defined. It may just have been like, I don't want to live with this inflation anymore, do something about inflation, but I'm not sure that was it. I think part of it was we will like divided government because we want the parties to serve as a check on each other. And that may be the biggest takeaway from the election, is that might be the mandate itself. But we don't know what the House and Senate leadership are. A senior Democrat talked to me this morning about what does Nancy Pelosi do? I have no idea. That's up to Nancy Pelosi. But the House leadership is going to be an interesting dynamic. I do think that with the win, securing the House that we expect, Kevin McCarthy has a great platform to run on. And I think that the leadership team there will largely survive. But it will be a much more difficult environment, right? I think that he may have to give some concessions to Freedom Caucus, RSC type folks to get that speakership. Senate leadership, obviously, McConnell played a brilliant game as he usually does. I think Schumer was very artful in getting a lot of very difficult pieces of legislation passed through an evenly divided Senate. And so we don't expect a lot of changes there. Obviously, there's 2 races with Blunt's leaving and we would expect Joni Ernst to kind of take that. But what's the agenda? What can or will Republicans and Democrats do? And will they move to the middle to try and strike these deals? And will Biden take Obama's lead from 2011 and move to the middle and try and get some kind of policy deals that he can then presumably run on in 2024? But it also begs the question, with divided government and with the dynamics I've already talked about, will anything of significance kind of happen? And that's, I think, an open question. So we wanted to talk a little bit about, if Republicans, where I'm going to focus on the House, not the Senate, and because that's more knowable or more certain than the Senate. So if there is a Republican House, like, what are we looking at over the next couple weeks and then into 2023? What kind of happens? And obviously, we've already passed Election Day. So the next thing we're looking at is what happens with leadership elections, what happens with committee chairs, what happens to new members in terms of orientation, and how are they viewing the current environment, and then what new members are going to go to different committees. And I think you'll see, there's vacancies at some of the A committees, Ways and Means, Energy and Commerce, where you're going to see new members come on, like Dana Harshbarger or Miller Meeks on Energy and Commerce, or Beth Van Dyne, and the chairmanship, obviously, at Ways and Means will be a new chairman. Budget committee may change up based on the outcome of the Ways and Means chairmanship. So lots of moving pieces here that'll come into clearer focus in the next couple of weeks. But that all happens fairly quickly, and I don't think Georgia changes much in terms of the legislation in the lame duck. It will change things in terms of dynamics within the Republican conference in the Senate, obviously, once that is known on December 6th. So lots to do in the next couple of weeks. And don't forget that there are pending Medicare payment cuts for doctors and hospitals who are mobilizing and actively pushing for stuff in the lame duck. And I'm not going to go through everything on this slide. We will make the slides and the recording available afterwards. I think the main point I'd like to say here is that members and I think interest groups, lobbyists, all have bigger eyes than stomachs right now. They're like a kid at a candy shop, and they're looking at a list a mile long of stuff that didn't happen before the lame duck, and they're trying to get those elevated onto the lame duck. And I think that it's going to be smaller than a lot of people think, especially if, as expected, the House flips. When you have that change of control, these bills tend to get smaller, and the last 20 years of lame duck have borne that out. Nonetheless, there is an incredibly long list. I think the appropriations bill and the defense reauthorization are both the vehicles, and that might end up into one big omnibus. But they both get done. There'll be some controversial stuff like Hyde and Conscience and the permitting reforms that Senator Manchin has pushed. And then you see those laundry list of issues. There's a lot unresolved in Medicare and Medicaid. FDA, public health are the four primary ones. But then don't forget, the Senate has worked on a bipartisan basis for more than a year on mental and behavioral health issues. And I would say that Wyden and Crapo are fairly far apart in terms of scope and dollars. So I don't know if that happens. It doesn't mean these things die. It does mean that they get pushed into next year, because I think Congress and their staff have invested a lot of time and resources into them. They're things that represent problems that need to be addressed, and that folks want to be addressed. But if I had to guess, I'd say, even though we're hearing right now from Democrats and Republicans, they don't want to do anything, something on provider payment gets done. That's a issue facing us right before the new Congress. Well, Republicans are reluctant to help pay for PAYGO because of provider support for some of the Democrat bills. I think Democrats are reluctant to go to 2% sequester. because they're looking at Medicaid redetermination as the primary issue of concern. So there's other things like the Puerto Rico issue and extenders and things like that. I don't need to get into all the details, but the point here is that I think a lot of these things get kicked into next year if they're not an immediate, right in front of me problem. That's going to create headaches and heartaches as the House Republicans seek to go into next year and establish their agenda, and as the Senate tries to figure out how they're organized with an evenly split Senate. So I wanted to get back into like, what will the new members think about? What will the House think about in terms of next steps? And right before the election, we put out a candidate report. We looked at 116 of the close elections and the key health policy positions of both House and Senate candidates, both sides. It was not a small undertaking. And you can see there, Zach Nunn and Cindy Axne in Iowa. Representative Axne will not be coming back after January. And so, we went through all 116 candidates' elections, I should say. And what was their healthcare focus? We looked at their website. We looked at any materials they put together. We looked at their voting records, if they came up through the state legislators or had some kind of a history in Congress, like incumbents. And we quantified those race by race and had a couple of key takeaways here. First of all, for Republicans, healthcare was not a focus and it wasn't a consistent issue. A lot of candidates didn't have a healthcare agenda. And when they said something about healthcare, it was not disciplined, right? Not consistent. It generally revolved around getting government out of healthcare, expanding choice, competition, transparency, stuff like that. If you want to go back one slide, that'd be great. In terms of the Democrats, they really were very focused. They were either talking about abortion or expanding government-run programs or both. And they were disciplined and consistent on that messaging. And I would say that messaging resonated with voters because it talked about on the abortion side, the perception was you took something away from me and you're working to protect it. On the government-run healthcare, it's, oh, you're going to help me afford my coverage. And what we've seen in our own polling has been voters really they like their insurance. They mostly have private insurance, but they want it to work better. And when they say work better, what they mean is they want lower out-of-pocket costs, lower premiums, and less hassles. And that's really what the Democrats talk about when they talk about government-run healthcare, right? It's going to be cheaper for you. It's going to be consistent. You're not going to have to worry about it. It'll give you security. And that resonates with voters. And the only other point I'd make on this slide is that what we did see from like Masters and Vance in particular, at the end of the election, they really came out and talked about the need for more price controls. And so there was this odd intersection between what the Democrats were saying and what some of these candidates were saying. And unclear how that's all going to play out next year, but that is definitely something that we're hearing about from some of our customers and clients. So moving forward, the question I've gotten the most on is, well, what will Republicans do if they control the House? What will they do? And as I already indicated, it's kind of an open question as to whether they'll just go messaging bills and try and force vetoes and score political points, or do they actually want to get something done? In my conversations with leadership and with committee chairs, they want to get stuff done. They see an opportunity to maybe advance the ball, maybe not as far as they would want, but they definitely are not looking to just score political points on messaging bills. They want to do stuff. And they've kind of told us what they want to do. They have told us what they want to do. So the RSC blueprint is out. If you haven't read it, there's a whole section on healthcare and on Medicare. And so they've laid out kind of like where they want to go, obviously further right, I think, than maybe leadership, politically much more difficult. The Healthy Future Task Force was a creation of Kevin McCarthy, and spent a year pulling the agenda together. And it was basically in these buckets. We'll get into more detail in a second, but really focused on market-based reforms: affordability, choice, competition, transparency. And they'll have solutions across all those areas, like supporting small business coverage, like making health coverage more transparent and affordable, increasing choices available to individuals and businesses and folks in Medicare and Medicaid as alternatives to perhaps to the traditional programs. On drug policy, I think it's all about IRA implementation and chipping away. Medicare solvency is a huge issue, and I think they're going to link that to the debt limit, which has to be raised or suspended by Q3 of 2023. And that's kind of a locomotive to pull the train of other Medicare changes like site neutral payment reform, perhaps 340B, a growing effort in the House, at least bipartisan, to reform how physicians are paid under the MACRA program, and getting that funding a little more certain and stable and predictable over the next couple of years, as physicians and hospitals face literally 10 years of cuts. Public health is the one area where I think that Democrats and Republicans can really come together. I think there'll be a lot of oversight there, both from what's expected to be Congressman Comer's oversight committee, but also from Energy and Commerce and Ways and Means and Budget. They're going to look at funding. What did we get? How much did we spend? How much is left? Was what we spent effective? The data modernization initiative and CDC in particular, and holding public health offices, whether it's CDC, NIH, FEMA, ASPR, BARDA, et cetera, accountable for the decisions and the information they put out and the funding they have, and making it more transparent to the American public. Mental health, as I mentioned, was a major issue of bipartisan support, and then scheduling fentanyl so that we can begin to address the 100,000 plus deaths from fentanyl and opioids every year. And then I've had a number of conversations with members about technology and data, and really the need to either enforce the rules that have already been issued, or to get to a better place on sharing data to improve healthcare. And then privacy was a huge issue this year with the Pallone-McMorris-Rogers bill. I think that may serve as a starting point this next Congress, but there's also an effort to work on a privacy commission to get national experts to provide additional feedback to Congress about how that bill might be changed, considering the California challenge with privacy, and how the California delegation essentially shut that whole effort down by saying, not in our state. So there's some issues to work on there. And then I think artificial intelligence and machine learning is an emerging issue that'll play a prominent role in Medicare modernization and healthcare generally, that Republicans will pursue. So that technology and data bucket is going to be significant, but probably underappreciated. So getting more specifically to the Healthy Future Task Force, you can see the list of all the stuff here. Basically just a summary of the documents that the Republicans have already put out. We can go into any area at the end that you want or after the webinar, but it's basically affordability, market-based healthcare reform, expanding choices, competition. On the drug side, I think what we're hearing from House committee member offices and the committee staff is, all right, we got this HR 19 bill, which was the Republican healthcare drug pricing coverage alternative to HR 3 or the Inflation Reduction Act. What do we need to tweak and change in that bill, considering the Inflation Reduction Act has been enacted? And I think the big issue there is Democrats want price controls and more government-run healthcare. That really resonates with a lot of voters. What's the Republican alternative? It's free market, private sector healthcare. How do we write that into a new bill, knowing that we're not going to repeal the IRA with President Biden in the White House? The other thing is that, like that chip away strategy on the IRA, I think, we start thinking about discrete issues like, can you use QALYs or quality adjusted life years for coverage and reimbursement purposes, or in setting prices in the IRA? And I think Republicans, if they put a bill like that on the floor, it would be very difficult for Democrats to vote against. So think about it in two buckets with drug policy. It's either it's really hard for Democrats to vote yes, or it's really hard, it's you get to 430 real quick, 435 real quick on a bill because it's just really hard to vote against. I would put qualities in that bucket. I think that expanding competition in the products in the IRA that are subject to price controls, like the only way you come off the list is generic. Well, there's brand to brand competition, there's therapeutic competition, and really, if we're intending to address monopoly pricing, brand to brand shouldn't count. And then doctor-patient relationship is all about reducing burden and enhancing the doctor-patient relationship. I would put MACRA into this bucket. I think MACRA is going to be a significant issue in how physicians are paid in the Medicare program. Program's not working very well. A lot of providers are exempt. A lot of providers are facing 10 years of cuts. A lot of providers view it as busy work versus doing stuff that actually improves patient care. And part of that is electronic health records and how those have become a burden to people. I mentioned public health. I do think the oversight in this area will be both gotcha and substantive oversight. The substantive oversight, I think, will unveil problems and how the country responded to the pandemic and what needs to change with our public health offices. And that will lead to legislation. And I think there'll be bipartisan agreement on some of the issues there. And obviously, fentanyl, opioids are a huge public health challenge. I think Congressman Guthrie in particular has been all over that issue. There are lots of folks like Custer and others on the D side who have been very focused on that issue as well. And I can see a lot of bipartisan agreement there. And then I kind of went through the modernization stuff, but really telehealth. Republicans want to permanently expand telehealth in the Medicare program and then tackle some of the challenges in the commercial sector, like interstate licensure. And how are we integrating the data in telehealth into electronic health records and producing good outcomes that might be AI assisted? So it's a robust agenda. It's all laid out, like I said, in their documents. And like I mentioned, lots of conversations with members of Congress and leadership and on the committees who are very excited about pursuing this agenda. They think it's, it's the right way to go. And I think the challenge here is going to be turning a list of ideas into a high enough level message that will resonate with voters. Well, that will be a real challenge. So how does that fit into the environment? What's a must do versus a want to do? I think a lot of the things that you just saw on that list are want to do versus must do. And so if you want to do those things, and I believe Republicans do, like I said, they have to move to the middle to get it through the Senate, to get it through, to get it signed by President Biden. And one of the interesting things that I've heard recently is there's not a strong desire to do a reconciliation bill. And that obviously raises the bar, the hurdle in the Senate to 60 votes. So if you got to get 60 votes, you've got to move to the middle. Otherwise, you're dead in the water. So the must-do side, PAPA, is the public health response, things like stockpile, emergency preparedness, and things like that. That could be a vehicle to carry some of the issues uncovered during the oversight agenda. And some of the reforms I think both Democrats and Republicans believe are needed. Debt limit, as I mentioned, Q3, that could carry a lot of the Medicare changes. The appropriation stuff, obviously a perennial issue, and some discussion about how to improve that process so that we don't end up on December 16th wondering if we're going to have another week before Christmas of legislating to get the agencies funded. And then finally, there's some expiring provisions in both September and December in Medicare. And I think that for Republicans, they want to figure out, do these programs work? Should we extend them permanently, or should we let them expire and just go away? So those are the must-dos. The want-to-dos, to the extent they can fit into the must-dos, I think will go left, go to the middle. and maybe get done. Otherwise, if the dynamic becomes more conservative members who've maybe extracted conditions from McCarthy to be speaker, you might end up with more messaging bills and really trying to tee up an agenda for 2024. So what will happen if those are the must-dos and the want-to-dos? What will happen? I talked about public health reform. I do think that's an area of where a lot of progress will be made. Medicare changes, I think macro is kind of a mess. People are overburdened, they're feeling pinched financially, and they're politically engaged, and they've got a loud voice and a megaphone, and they're able to move votes. So I'd be surprised if we didn't see any Medicare changes as part of the debt limit. I just don't know how big or small those might be, or if they end up being kicked out to a commission, as has been done in the past with and then those legitimate changes to the Inflation Reduction Act could be bipartisan. On the market side, I think there's a growing recognition that healthcare markets are highly uncompetitive, whether it's hospitals or physicians or health plans or drugs. I think folks have put their finger on different challenges in different markets over the years. And I would just note that the FTC has become much more aggressive and visible in this area. And that's, and Congress has too, in terms of technology. It doesn't seem like healthcare is the same as technology competition issues, doesn't have the same kind of juice or sexiness to it. But this is part of what the Republicans put in their Healthy Futures Task Force agenda. There's been legislation introduced both sides of the Hill, Braun and Biggs and Victoria Spartz and others, to address some of the challenges related to market concentration and lack of competition in healthcare. So something there may move or may be addressed through the FTC or even through the administration, because the problems are anti-competitive, antitrust in nature. They're reimbursement driven, they're like 340B driven or regulatorily driven or politically driven, like with not-for-profit hospitals. So lots of challenges there. I think that's going to get a lot more attention next year. And that has agreement across Democrats and Republicans. And then I think they'll fight on bigger Medicare reform, like some of the issues that are laid out in the RSC blueprint, whether it's premium support or, going full throttle after 340B, reimbursement cuts, in particular, if that's going to be a part of the debt limit. I think you'll see a lot of interest groups start lobbying against that. And I know legislation's already been introduced in the Senate to repeal the direct negotiation provisions of the Inflation Reduction Act. If that gains some steam and gets voted on, I think that'll be a big fight, and will highlight this dynamic between one side wanting government-run healthcare and the other side wanting private sector healthcare. And then anything on the health reform side, I think there'll be some oversight here. But if Republicans really seek to kind of go after the ACA again, and they've largely abandoned their conversation around repeal and replace, but still see challenges in the ACA markets, whether it's high deductibles or premiums or narrow networks or whatever. And if there's a significant effort to roll back the IRA, obviously that becomes more of a messaging bill and a Biden veto. But significantly expanding or changing how private coverage is done may be a fight. I do think that members of Congress would be hard for Republicans to not support small business health reforms and provide more resources there. And I think it'd be hard for Democrats to argue against them. So maybe that expanding private coverage for small business belongs in the areas of agreement, but it depends on what they do there and if they link it to other ACA type policies. So we don't want to ignore the regulatory outlook. And I think the key point here is that Congress has ceded so much power to the executive. The executive has a lot of tools and demo projects funding at their disposal to really change up healthcare. And so I think that if Congress gets deadlocked or gridlocked in kind of this, more partisan warfare, if Biden doesn't move to the middle, I think you'll see a lot more on the regulatory side. And that's hard for me to say because the regulatory stuff has been so significant over the past 5 years. And certainly, we've seen an uptake since the Biden administration took over. So some of those issues that we're looking at, in particular on the regulatory side, the end of the public health emergency is kind of front and center. And if the administration decides not to extend that in January, we're going to be looking at the Medicaid redetermination process and unwinding policy. We're talking about any estimates of anywhere between 6 to 20 million people who may have moved or died or gotten other or are eligible for other coverage. And that's could be a real headache. The states need good data to be able to do this well. And good data on the Medicaid side is hard to come by. So CMS is being as flexible as possible and encouraging states to work with plans to, do this unwinding policy so there's not that disruption. And at the same time, if someone's been on the rolls and they're enrolled in another program, you want to make sure that we're using taxpayer resources wisely. So that's the tension. I think that something on redetermination will be in the lame duck package, whether it's maintenance of effort or some kind of a flexibility to ensure that unwinding policy actually works out well, will be important. Next, the Inflation Reduction Act. It's hard to start a business, right? And CMS has to stand up a Medicare PBM. And they've got 6 different divisions. They've got 95 leaders. They're hiring for 200 other positions. Right now, they've got basically between now and 2026 to make sure those price controls go into effect, but stuff is already starting, and it's hard. They're going to have to rely on some private sector expertise in terms of what the drug prices mean, what the utilization means, how it should be priced, why it's priced the way it is. Those are not areas of specific expertise within CMS. So standing that up is going to be difficult, and then administering the program is going to be very difficult. And all of it gets done through sub-regulatory guidance or sub-regulatory program rules for the next 4 years. The law says I don't have to issue a regulation and go through the normal rulemaking process for 4 years. And so we could see some oversight here. We're already seeing demands from Republicans to be kept in the loop and to answer lots of questions. But we saw after, I think it was a month or two after the Inflation Reduction Act was enacted, the president issued another executive order telling CMMI to come up with some more ideas. We are expecting those ideas to be smaller in nature and voluntary in nature, and not step on the Inflation Reduction Act implementation and operations. But clearly they're not done. They think the price control issue is a winner, and they want to keep going after that. And certainly there's problems in the market, but with that authority, CMMI authority, we expect that to be a continued push. We also think that the PBM issues that some have highlighted, obviously left off the Inflation Reduction Act, will come in through the regulatory process and be the subject of both, reports and FTC investigation and perhaps congressional scrutiny. Expanding government-run healthcare. There's a lot of tools here that the administration can use. The one they've used to date has been 1332. Want to make that sticky. They know they're not going to be in those seats forever. And so incentivizing states to move more to a public option. I would note the Inflation Reduction Act was the precursor to a public option. Public option says government sets the rates, private insurers take those rates and provide coverage. Now, we only did it on the drug side. So you'd have to expand that to hospitals. You'd have to expand it to physicians. But basically, it's the toe in the door for a lot of the public option type models. And we are scratching our head about the short-term insurance rule that the Trump administration expanded to 12 months. We've been expecting a pullback on that for a year now. It's been on the regulatory unified agenda. It was a regulatory initiative by the Trump administration. We're expecting that next year. We're expecting a pullback there on those policies. And then the last three, equity and health disparities. I would say this is the prism through which the Biden administration views most issues. And I think that, requires, there's a CMS health equity plan that just was released in April. It involves collecting data and understanding what's going on, then arming CMS partners like hospitals, doctors, plans with information, and improving the workforce to be able to address those issues on the ground. I think until we see that true partnership, it will continue to be more happy talk than more light rather than heat, I think is how I'd put it. But we're excited about that because obviously health disparities drive a lot of costs, a lot of bad outcomes for patients. And so it's a real problem I think most people recognize needs to be addressed, but should be addressed in a fundamental way. And then the last two, data rules, privacy, interoperability, standards for AI, electronic prior authorization across programs. These are all rules that are on the unified agenda. And so data kind of governs what we know and how we act. And that's going to be, I think, a focus next year. My hope is that, the administration has a set of rules and laws they need to implement and enforce. And to the extent that there are things like standards for AI don't inhibit innovation, I think is a major issue there. But clearly they're looking at transparency of AI, trustability, bias, things like that. And then electronic prior authorization, that's really about making it less burdensome for doctors, pharmacies, and patients in getting access to the drugs that they need to improve their health. And I already mentioned the competition agenda, but we expect the FTC to continue to be aggressive in that space, and continued scrutiny from both the administration and Congress on areas where we lack competition. So I just wanted to end with this, or last policy related slide, I guess. This is just the beginning. We do a lot of work in the drug space and coverage space. And it was just really interesting to me that ink was barely dry on the Inflation Reduction Act when that executive order came out. And we've seen a lot of statements from the president and others about this is just the beginning. We want to go harder here. So I would expect that. I don't think that, I think, the Inflation Reduction Act made a lot of people think like these drug pricing issues are really resonating with people and we should go further and keep going. And I don't think there's anything wrong with that, in terms of, wanting an issue. But I think what we're seeing as a result of the policy is concerning. And by that, I mean, before the Inflation Reduction Act was passed, the Congressional Budget Office estimated maybe 1, maybe 8 products wouldn't get developed. The University of Chicago said maybe 300 or more. But it was kind of an academic exercise about how many products wouldn't get made. And what we saw last week was a vision product, a cancer product, not coming to market, being defunded for phase 3 studies because those companies said of the incentives in the Inflation Reduction Act. So if we see more of these products not coming on market, that's a political challenge for the administration that they're going to have to manage, and for the Democrats, I believe. Because when you looked at the polls, most people said they support direct negotiation and Medicare getting involved in these negotiation processes. But you took about 20 points off those polls in terms of support, 20 points less support. If you said, well, what if this led to fewer cures? Like, what if it knocked off a cancer cure? You lost a lot of support, and it kind of runs counter to the message that we're hearing from the Cancer Moonshot Initiative and wanting to really lower death rates by 50% over the next 25 years. So You can't do that without drugs. You can't do it without innovation. And so this is a trend that we're definitely watching. I think it's going to be both regulatory and legislative. It'll come up and continue to come up based on the issues we're seeing. So with that, I wanted to just say, we are a full service firm. We've got a bipartisan team of experts here. I hope you enjoyed the presentation today. I don't profess to have all the answers. This is what we're seeing in the numbers and in our conversations with members of Congress and the administration. And if you want to connect with us, my contact information is right there. So, and Colton, I don't know, are we taking questions?
I don't believe we have time for that today.
Okay. I'm sorry, I do see one. Just real quick, Amy, my friend, asked me about the redetermination policies and the omnibus. What we're hearing is a maintenance of effort requirement on states to ensure that there's no gap in coverage. I think if they end the public health emergency in January, CBO estimates the PHE goes further than that. So there's kind of like paper money on the table, and they could use that for maintenance of effort to ensure that there's no gaps in coverage for people who might be redetermined out of the program. And I think, whether they phase down the 6.2, I don't know. I think there's all kinds of ideas on the table, but we'll see what they come up with. But again, I've been surprised that this has been, is definitely on the list. And I think that flexibility at the state level to make sure that people don't fall through the gaps is a key priority. So I don't know exactly what it looks like, but it definitely looks like something. So thank you, Amy. Really appreciate that question. And then if anyone wants to connect afterwards, just reach out to me. The recording and the slides should be available on the website. I just want to thank everyone for participating today. It's a interesting time, definitely in flux, but really appreciate your time today. Thank you.